What's that? Who did that? All right, everyone. Welcome to our Ask the Trainer virtual personal training webinar. I know Amy probably did this. My name is Emma Slappy. I'm the wellness coordinator here at Cox Fitness Centers in Atlanta, and I'll have Shaw introduce herself as well.
Hi, everyone. Thank you so much for joining us today. My name is Shaw St. Louis, and I'm the fitness coach here at Cox Fitness Center. Welcome.
All right, perfect. I'm going to go ahead and share my screen for everyone. Give me 1 second. We will get started. All right. Can everyone see this PowerPoint okay? Shaw, I'm counting on you first.
Yes, ma'am.
All right, perfect. So welcome to Ask the Trainer. So this webinar will just talk about the benefits of virtual personal training and the importance of incorporating exercise and an exercise program into your overall health goals and how we can help you get there. So the first slide we have is the biggest question that we get from everyone as personal trainers is how often should I be exercising? And so we always go off of the American College of Sports Medicine, ACSM, their recommendations for the average adult. So for aerobic exercise, which is anything from walking, running, riding your bike, swimming, anything that gets your heart rate up and keeps it there for a long amount of time. And so the recommendations for that
Your call has been forwarded to an automated voice messaging system.
I'm not sure what that was 10,000 steps per day or 5 miles.
0.
It's 30 minutes per day, 5 days a week of any moderate intensity exercise. So moderate intensity, you want to be a little out of breath. I'm echoing, but not super out of breath to where it's vigorous and you can't talk. And then for strength, so when you're coming into the gym and lifting weights, getting those muscles strong, that's a minimum of at least 2 times per week, working on our major muscle groups. We have 3 sets of 8 to 12 reps of those. And those are both minimum recommendations. So you can always overachieve and do more, but do keep in mind that if your body is telling you to rest, listen to it and rest if you need to. And then lastly, we have flexibility and balance. And these are 2 things that often get overlooked. We all need to stretch and stay loose, especially a stretch and relax session to break it up while you're at the office is perfect. And then working on your balance as well will help you as you get older. It'll help lessen falls. And so that is a minimum of 2 to 3 days per week to improve range of motion in the joints, and then repeat it 2 to 4 times with a hold of 60 seconds per each stretch. So I hope this slide was helpful for you guys. These are just the minimum recommendations. As we say, you can always overachieve and go above and beyond. But I will have Shaw go ahead and take the next slide.
Okay, well done. So the next slide, we're going to discuss just a few. There's a ton of benefits, but we're only going to cover about 6 of the benefits of daily exercise. So the first one is just, it's a mood enhancer. Exercising releases 2, I call them happy chemicals. The first one is serotonin, which helps your brain regulate your mood, your sleep, and your appetite, which that's super helpful. And the second one is endorphins. You know, that speed, you always see those speed commercials and go get your endorphins. It actually is true. Exercise releases that happy chemical called endorphin, which just immediately lifts your mood and makes you happy. It also increases your energy by circulating more oxygen throughout your body, which also helps your mood and your focus. And it's also a great outlet for just releasing frustrations and stress. So the next one builds strong muscles and bones. So a lot of you know that this is true. This is one of the main reasons people come into the gym. Strength training increases bone density. That's something that decreases as we age. And it also increases muscle mass, which is another thing that decreases as we age. So those are two things that we want to use exercise for to combat that. It also helps with joint flexibility, super important. A lot of people, as they get older, they run into things like arthritis. So this also helps with balance. Balance is one of the main reasons we fall as we get older. A lot of people get that mixed up and think it's, oh, I'm just not strong enough. No, it's actually your balance. So by keeping that flexibility and that balance through, strength training and exercise, we decrease the risk of falling as we get older. All right, so the third one is it reduces risk of chronic disease. Several diseases are included under this umbrella, and it all comes back to just a healthier body. Allows your body to be able to fight things a lot easier. Some of the diseases it fights as it's, stronger are type 2 diabetes, obesity, heart disease, depression, anxiety, arthritis, cancer. You see where I'm going with this. We could continue to go on and on. And again, go back to it improves your blood and oxygen flow, which increases your body's overall wellness and is able to fight off things a lot easier. And number 4, reduces pain. Exercise reduces the severity of chronic pain by improving your strength and your functionality and your flexibility. And number 5, promotes better sleep. It's awesome to get rid of excess energy, and it helps our bodies rest longer and improves the quality of our sleep. It's a stress reliever, so it allows your stress to go somewhere. And it also helps with insomnia. So if any of you are suffering from that, it's a great reason to get in the gym. And lastly, weight loss. This is something that most people come in here for, again, weight loss or maintenance. As you gain muscle, your body burns calories even when you're sitting down. What do I mean? Okay, so for instance, to be exact, your body burns 6 calories per hour per pound of muscle and 2 calories per hour per pound of fat. So obviously, the more muscle content that you have, the higher calories you're going to burn just even at rest. So that's a fantastic reason to strength train and exercise. And Emma, I'm going to pass it over to you.
All right. So next, we're going to talk about the challenges of working virtually. So 2 years ago,
Oopsie, Emma.
And thrown, into a new.
Emma, go back a little bit and repeat because you went silent for a second. I don't know what happened.
Okay. Yeah. So the challenges of working virtually. So 2 years ago, when the pandemic hit, we all had to start working from home. We couldn't go to the office anymore. So this sort of brought up a whole new plethora of challenges that people needed to face. And so we have come up with a short list of just challenges that people have talked to us about from working virtually at home. And the biggest one that we've seen is that they end up sitting for hours on end. Normally when you come to the office, you're walking around, maybe you go to lunch, go to meet with your home coworker, but normally you're up and about in the office. And when you're working from home, you probably just get up and go sit down at wherever your home office is at your desk, and you probably sit there for 8 hours straight without getting up. And so it's super important to start breaking up those long hours and maybe getting up, doing a stretch break, something for 5 to 10 minutes, just to make the day, break it up a little bit so you're not sitting for 8 straight hours. And the next one is eating unhealthy snacks. So that's one of the big things that we have seen from people is that they're booked meetings back to back. And so the quickest thing for them is to just go to the pantry and grab the first thing they see, which is probably, a bag of processed foods. And so making sure that you're keeping fresh produce, fresh fruit, some healthier foods around so that your first instinct isn't to go grab the thing that's the most convenient, that you already have those fresh products available to you. The next thing is having an inconsistent schedule. And so I know working from home, you probably have meetings back to back all day. Your work hours may be all over the place. You might have a meeting at 9 o'clock at night or 8 o'clock at night. We're not working a regular 9 to 5 job. When you leave work, you go home and you leave your work at work. So that's one of the biggest things that we've seen, as well as people trying to find ways to fit working out and exercising into their schedule, because it has become so inconsistent. And that brings a lack of motivation and a lack of accountability as well. They may have had a routine, and they may have gone to the gym before going to work because the gym was on the way to work, or going to the gym on the way home from work. And so, when you throw a wrench in that and you don't have that going to work aspect anymore, we have to find other ways to stay motivated, whether it's having a virtual personal trainer to help you keep accountable, finding a buddy or a workout partner. Last thing is not planning meals ahead of time. And so that's a really big thing that we see. And what we've recommended is possibly going to the grocery store with your week already planned out, so that you have everything that you might need as far as breakfast, lunch, dinner, and snacks. You can go to the store with your list of healthy foods, and you can plan those meals out. So you don't go to the grocery store without a plan in your mind, and you're just grabbing things that you see. And so those are just a few of the challenges that we've seen working virtually, and those may not apply to everyone, but those are just the ones that we have seen as far as virtual personal trainers with working with people. And so I will go ahead and hand it back to Sean. She'll talk about the benefits of personal training virtually.
Okay, so I'm just going to run over a few of the benefits of having a virtual personal trainer. Well, number one is convenience. We come to you. So that is that opens up a world of flexibility and options. You don't have to leave your home. You can find a little corner. We don't need a lot of equipment, and it's just a win-win situation. So the second one is safety. You're staying safe. You're staying away from others. You're in your own home. You don't have to work out with a mask, and you're in your own surroundings. So obviously it's going to be a little safer than being out in the general public. And number three, professional guidance. We're certified, we know what we're doing, and it's just, we can create individualized programming for you, which will be curtailed to if you have modifications because of injuries or whatever it is. We can make it work for you, and we take the guesswork away from you, keeps you on a schedule, keeps you accountable. We become a team, which is great. And we offer motivation, which is a big, huge thing. Even trainers need a training buddy. So I'm not going to go any more into it, but I just want you guys to know that we are here, and this is a great service, and I hope you take advantage of it. Emma, I'm going to pass it over to you.
All right, so the next question is, if you're interested in any of this, the next question would be, where do I start? How do I start virtual personal training? And so the first thing that you would do is you would get a 15-minute complimentary intro to PT, as we call it. And so from there, you'll meet with a virtual personal trainer, any of us that fits with you and fits with your goals. And we'll talk about setting goals, getting a plan going that's right for you. And then we'll perform a series of basic movements to assess a baseline. So we'll assess how you're moving, watching you perform basic things so that we may see if there's anything off or any asymmetries in your body that we'll need to know about. And then next we'll set SMART goals. So setting a goal that's realistic for you, that you can attain, and then mapping out an individualized program. And we do like to emphasize the individualized part of personal training, because even though if you're at home and you're not in here with us, you will still get an individualized program. We like to say that each person is unique. What I do for training compared to what Shaw does for training, we're both different people. So each person is unique. So what may work for her may not work for me. We're all built differently. And so we do like to emphasize that. And so making sure that, we're here to meet you where you are in your life, wherever you are. So finding the right program that works for you and your goals. And so next, Shaw is just going to talk a little bit about some resources that we think would be good for you guys to know about.
Okay, so we have a wonderful registered dietitian. Her name is Alyssa Palladino. Some of you may have been on one of her workshops recently. She is a wealth of information. We have her contact information on here as well as some other links. The Nutrition 101 workshop, which she did, was fantastic. She goes into macronutrients and just, you know, demystifies a lot of the whole questions around diet. What should I be eating? When should I be eating it? Types of foods, and it's just excellent. Portion distortion is another workshop. I actually did that one, and I just go into how to control portions. Portion control is a big diet buster, and you know, it's just good to know an easy way to control it while you're out or at home. And I also talk about meal prep and snacks, snacks that you can have at your desk while you're working, whether it's virtually or in person, and just ideas for food, keeping things super simple at home. And then we also have pre and post workout nutrition. This is something we get asked all the time, and it is important what you fuel yourself before your workouts with, because that's going to carry you. And if you're not fueling properly, you're just not going to have the energy, and it's actually going to turn you off from working out. So it's super important to know what your body needs before as well as post. So if you've worked out your muscles, what should I do to feed my muscles after? And then we also talk about, we have a workshop, making the most of your time. And that, again, Emma kind of spoke about, working virtually has thrown a wrench in a lot of your scheduling. How do I schedule in movement? And it talks about different things and different ideas. So these are awesome links. We will have them up on the Cox Impact page that you can actually just click on it and access it. Emma, back to you.
Yep. And we will be sending this recorded, because we're recording right now. So we will send this out to everyone who's registered. So you will have access to all these links as well as these PowerPoint slides. All right. So next, I'm just going to talk about basically our virtual trainers available to you. So first, on the left side, we have our general manager, Amy Bush, and her specialties are HIIT training, so high intensity interval training, and functional training. And her email is below. Shaw, our fitness coach, is in the middle. Her specialties are strength training and weight loss, and her email is below. And then I am on the right. My specialties are also HIIT training and then flexibility and balance. And then my email is below. So obviously pick a virtual personal trainer that you think fits your goals and your needs. We're all available to help you guys. So, you know, we would love to hear from you. Next, I'm just going to go over, this is just our personal training pricing. So we have 1 hour packages of 1, 4, and 8 sessions. We have 30 minutes one-on-one of 1, 4, and 8. And then we also have small group training for only 60 minutes. And that is 2 or more people. And the pricing is per person on that. But so you'll also get this slide emailed to you. And if any of this interests you, you can contact Amy Bush and she will get you set up with virtual personal training. But that is it for the presentation. We're opening the floor for you guys to ask any questions that you would like. And I will go ahead and stop sharing my screen. But the floor is open for you guys. All right. So our first question is, how do you avoid your body burning muscle for energy as opposed to fat? Shaw, would you like to answer that one?
Yeah, sure. So there's anaerobic and aerobic. I'm not going to get too wordy, but the way that you do that is you try not to work in the anaerobic, which is when you work above your 85%. So think of this, you're working at a high intensity for a long period of time. So you're breathing like that. That tells you, if you prolong that, you eventually are going to start burning muscle for energy. So you want to stay between 65 and 80% of your maximum heart rate. And we can help you figure out what that is. And that will keep you in the aerobic, which is a fat burning zone.
Great.
Also try to focus on one more thing. Also try to focus on less cardio and more strength training, because a lot of people don't think that they can strength train at a pace where they sweat, and you can. You can do supersets, which are training back to the same muscle group back to back, and opposite muscle groups back to back. There's a myriad of different ways that you can combine it and keep yourself going at a certain pace with active rest as well thrown in. So.
Yep. All right, next question. So we have 2 on where do you pay for your services? So we would do that through our system here in the gym, but we do it by credit card. And the next one we have, what is the recommended frequency of meeting with a trainer to get started? Or no, I missed one. Well, you can go ahead and answer that question, Shaw, and then I'll get the other one that I missed.
We usually, to make that decision, I usually, talk about what the person's goals are, and that will determine how often we meet. The way I train, some people say, oh, I want an hour, but they're not ready for an hour. So I recommend maybe 2 or 3 30-minute sessions, and I think that will get them to where they need to be quicker than wearing them out in 1 hour. So it's very individual, and I would meet with the person, or the trainer would meet with the member, and then we can decide what would best, get you to where you need to be. Oop, I think Emma's, okay, start over, Emma. You kind of
Yeah, keep cutting out.
Yeah, okay.
Yeah, so most of that is individualized, and that is something that you would talk to your trainer about. Probably the most common, that we have is twice a week for 30 minutes. But that is definitely, individualized and something to talk with your trainer about. So the next one we have is, what are the best exercises to do for an injured knee? I have a torn meniscus, which can't be repaired.
You want to answer that, Emma?
Yeah, so for an injured knee, I would say something that's non-weight bearing. So strengthening exercises for the knee and things that aren't hard pounding on that knee. So probably not any jumping. Ways to strengthen the musculature around that knee would be the best. And then also, we aren't physical therapists, but I would recommend going to physical therapy as well, just to complement the strength training that you would be doing to strengthen those muscles around that knee. And if Shaw, you want to hit more on that, you can.
One of the muscle groups that stabilize and help support strong knees and knees that are injured is just building your glutes. Your glutes is your posterior chain, your largest muscle group. So I would focus on definitely glute training.
All right, next one we have, I am exhausted today after a terrible night's sleep. How I know I should go work out. How do you decide when it's smart to rest versus exercise? So, I like to do that as just base it on how you're feeling. If you feel like you can push a little bit, do it, but obviously don't overdo it. As I said, listen to your body. If it's telling you that you need to rest, that's totally fine. I feel like a lot of us neglect rest days, and then our bodies start screaming at us that we need rest by, getting overuse injuries, or you're just so tired that you can't, function in your daily life. So I would just say, listen to your body. If it's telling you that you need to rest, then definitely rest. All right, Terry says, do you have to do all 3 areas of training to get a total workout?
All 3 areas?
I'm assuming strength, aerobic, and the flexibility and balance.
Oh, they're all kind of intertwined. And yes, I would say, so you can just do strength training, but you have to know what you're doing in order for it to get the optimum. You want to be optimally in shape. It's like somebody can lose, if they can lose weight, and they can get down to a certain size, but they're not fit. It's the same thing. So all 3 of those things, endurance training, strength training or weight training, and flexibility training, yeah, I I would say definitely, and you can work them all into each other. They don't have to be, you know, separate from one another. You can do one exercise for one, and you can also blend and combine them all together. Several ways to do that, so you can maximize your time.
And a lot of balance training exercises, you know, are a part of strength training, because balance training can be, you know, anything that's on a single leg, or core exercises that are challenging, you know, your stability and your base of support. So you do sort of incorporate those along with the strength training as well. All right. I know they're opening a gym at one of our locations. Is it helpful to do the virtual training sessions there? So Randy, I'm assuming you're talking about maybe having access to equipment, if that's sounding right.
And yes. Yeah,
Correct me if I'm wrong.
Yes.
No, that's
you're
correct.
Right.
Okay, yeah. All right. Yeah, so I mean, it's up to you. I know some gyms may have certain rules about, you know, if you're on a video camera or something inside the gym, but it's honestly like, we make virtual training. You don't have to have access to all sorts of crazy equipment to get, you know, a good, decent workout in. That's what we're trying to expand more knowledge on, that, you know, it could be body weight. You could have a set of dumbbells or a kettlebell to have a good workout in. And we are good at, you know, being creative and using the things, you know, around your house to help you get a good workout in.
So is that part of the, you know, when you're talking the assessment, that you're asked about the equipment that you have, so that it's built around what you have?
Yes, totally. Yeah, we can ask you about that. And that's something specifically if you're going to be at home and you may not have as much equipment as another person or anything like that. We're not going to make you go out and buy some crazy expensive equipment, because we need it for your exercise program. All right, what is next? If you can only do low impact workouts, what are the best exercises that you would suggest for weight loss? All right, Shaw, you're a weight loss expert.
I mean, there's a myriad. I mean, you can lift, lifting weights. If you have 20 minutes, regardless, this goes right across the board. If you've got 20 minutes and you come to me and you say, Shaw, I've got 20 minutes, should I do resistance training or cardio? I would suggest resistance training, because like I said earlier, resistance training, whatever calories that you burn, you continue to burn throughout the day. Whatever calories you burn doing cardio, that's it. So if you burn 300 calories on the treadmill, you only burn those 300 calories. You don't keep burning. So I think that will answer your question. I mean, you can, for low impact, you can do the bike, you can walk, but strength training is going to get you where you need to be for weight loss.
And that was pretty much the next question from Diana too, about weight loss. What piece of equipment do you think is the best for people in snowy areas to work out on inside? Treadmill, bike, weights. So weights, obviously, I would say a combination of all three throughout the week, honestly, but both of us, I think, would recommend weights before anything else.
Or anything else, yeah, for sure.
All right. Katrina said, how does the body assessment work virtually? That's a great question, because I'm sure that's confusing. So pretty much we would have you do some basic exercises like a squat or a push-up, and we would just look at your form. And so we're really looking at, you know, if your chest falls forward on your squat, because that would, you know, alert us that something else is tight or something else is restricted in another area. And so you know, your turn profile.
Pause. Back up a little bit.
Sorry.
This is good information, and you pause. So back up a little bit, about 30 seconds.
Okay. Yeah. So, you know, you don't need to be right with us for us to be able to see, you know, the correct movement and the correct posture in, let's say, a squat or a push-up. So that's something that we could easily see, you know, over a Teams call or a Zoom call. And that's something, you know, that we can easily fix. And we just mainly look at that so that we can see if there's any muscle asymmetries or differences that would alert us if something was tight or something was restricted in another area. All right, let's see. So Terry said, so 30-minute workout could cover all 3 areas and work with a trainer 2 to 3 times a week. Yes, I'm assuming.
Correct, yes.
Thank you. Said, if you cannot lift weights over your shoulder, what are the best weight training exercises to work your upper body? Francis, is that because you have a
Shoulder injury. Hold on. She'll be back.
Neck.
Okay, you pause for a second. It's a neck injury?
Mhm.
Okay. You want to go ahead?
You can go ahead. I'm reading all these questions.
So there are, to work your upper body, I would do things where you are supported. There's bands that we can use. You don't have to go above your head in order to work your shoulders. If you can do things this, even modified, it's just a bunch of modifications that we would do, but you can definitely work your upper body, you know, even though you don't have a lot of mobility in your neck. If it's an injury, then we would be very, you know, we'd have to get a little bit more information so that we know exactly what would be safe for you to do.
And then this is directed at Shaw. Prior to strength training, I usually begin with 10 to 15 minutes of cardio. Should I stop the cardio and jump right into weights or maintain a current routine?
No, I think that's great. I would do 10 minutes warm up, 10 minutes cool down. And I don't mean that, like, cardio is important. Your heart health is super important. So I don't want anybody to walk away thinking, oh, I'm not going to, you know, do cardio for the rest of my life anymore because I'm just going to work. That's not what I mean. But I'm just saying the bigger bang for your buck and how, you know, to do it. So definitely I would stick with doing, you know, your 10 minutes before and 10 minutes after, and then do your you know, your strength training. And that's what I just want you guys to understand, that, you know, resistance training is super important, but so is cardio. So we have to work them all in, and there's a way to do that.
Mm-hmm. All right. And then
She'll be back.
cardio exercise. And that's because of your neck, Francis.
Hold on. Emma, you went out. We didn't hear what the question was.
She said, Francis said, in my situation, what's the best cardio exercise for her neck injury?
I mean, Francis, honestly, it's what feels good to you. You know, walking, stairs, you know, biking, like a spin bike, things that, because a spin bike, you can kind of lean over. The walking, you're upright. I would just do low impact, nothing that is heavy impact like running. I think that would get uncomfortable after a while. Elliptical, I probably wouldn't do the elliptical if your neck, because it's a lot of, you know, that movement. And I just probably would stay away from that.
All right. We have, in addition to walking, what other types of overall exercises can I do with a bad knee? Biking, swimming, etc. Swimming would be great. Swimming's a great.
Swimming would be fantastic. Yeah.
Yes, swimming
And
would be
biking.
great. Biking is great because it's not high impact, and it's great for
But stationary biking, not
yeah,
biking
stationary
outside.
biking.
So definitely stationary biking. Like Emma said, swimming, running in the water would be fantastic. I've done that and it's amazing for recovery. Walking uphill, just a slight incline, like an incline of 8 on the treadmill. That takes a little pressure off. Yeah,
Like
those
gets your
are,
heart rate up too. You know, a lot of
it
people think walking is, you know, is super easy, but I mean, if you increase that incline, I mean, your heart rate can skyrocket up there.
yeah, for sure.
All right. Sherry asked how to determine what size weights to start with for strength training.
So my rule of thumb is to work heavy and then back. So I would start like a mid-range heavy, like 15 to 20, and see how many reps you can do with those dumbbells. And if you can only do 1 or 2, then starting with 20s, go back down. So the rule of thumb is by the end of 3 sets of 10, you should be struggling to do that last set. And that kind of lets you know that, okay, I'm challenging my muscles on some level. I always say less is more. So start, with lighter weights and then work your way up. Just don't stay with the lighter weights because you're just spinning your wheels. So I hope that makes sense.
Yep.
Anything else?
Treadmill to do a nice steady walk. I mean, I normally incline of 2 or 3 is like if you were to walk outside, that's what it would be, pretty standard. So that's up to you. Just keep inclining it until, you feel comfortable. You can feel a little bit on the uncomfortable side just to make it challenging and to make your heart rate go up. But that's honestly up to you. Everyone is individualized and unique, like I said. So, what I think is, good for a steady incline on a treadmill might be different for someone else. So that's just up for you to figure out. All right.
Question. So can I Zumba since I can't do anything else?
You asked if you could Zumba?
Yeah.
Zumba is a great form of cardio. If it hurts your knee, or is this
Neck.
neck
Yeah.
pain? Yeah, I couldn't see.
It's a very individual thing. If you Zumba and you feel okay, I mean, you know what not to do. If they're doing this, over their head, then you do this. Keep it low. So yeah, I mean, the answer would be yes, depending on what feels good. What doesn't feel good, just don't do it.
Mm-hmm.
Okay, thank you.
Someone asked, I played 2 hours of soccer every Saturday morning on an empty stomach. Good, bad, or okay? Well, I think both of us would say not good. We always suggest eating something before going to work out.
Yeah, you need something to pull from. I think that you'll just have more stamina and overall perform better if you have given your body some kind of energy source. It doesn't have to be heavy, but and this is where the pre and post workshop, I really suggest you listen to it because it's fantastic, and it'll give you suggestions of foods to eat, before you go and play for 2 hours. 2 hours is a long time, especially soccer. Yeah, I think you would feel better and perform better overall.
All right.
I just had a
Last one.
question about the elliptical.
Yeah, go ahead.
Is that really low impact? Because I got tore my ACL years ago, so I don't have full restriction. I don't have full motion of that knee. So, in using the elliptical for cardio, would that not make the knee better, but at least give me some point that I can work out maybe some scar tissue with that?
So I have worked with a couple orthopedics, and one of the main machines that they recommend for recovered meniscus and ACL is the stationary bike. If that's something that you could work into I would suggest the stationary bike and do upper body. Get off the bike and do your upper body. If it's the push pull that you're thinking that, oh, good, I'm getting upper body workout and cardio. I would do a spin class or the bike on your own. That would be my first suggestion.
Thanks. So elliptical,
You're
you're just not up on that, or you're not a big proponent of that.
Not for your situation. I mean, I always tell people find a cardio that they like and they can stick to, but it's just for you specifically with what you've had done with your knee, with the, range of motion. And I just think that you're working out that cartilage at that scar tissue on that push and pull with it going around. I would suggest the bike over the elliptical, yeah.
Okay. I won't make it worse until I get a bike doing the elliptical, right? Because that's what I got in my house. So I'm just trying to
Have you tried it?
utilize what I have, huh?
Have you tried it? Like, do you do it currently?
I have. I'm getting back to it, but I didn't have some of the same.
Issues with
I did not, and I know with
Right.
the bike, because of restrictions, I could sit at a certain height, and then I would work from that height on trying
Right.
to get better mobility. But with the
Yeah.
elliptical, it seemed as if I didn't have that stress. So that's what
Right,
I was.
right.
Yeah.
Right. Well, see how you feel. I mean, does your knee swell when it's overworked still?
No, not yet.
Okay, good.
No,
So
I haven't had that.
yeah, good. All right. Well, see, I mean, like I said, if the elliptical is what's calling you, my personal opinion would be the bike. But I mean, if the elliptical is what you have right now, I would take it in small increments and see how you feel.
Okay, thanks.
All right, and then it seems like we have one more question, and that is, how does intermittent fasting fit into personal training? So that's
all
more,
you.
that's more of a nutritional question. I know none of us are a proponent for intermittent fasting, and so that would definitely be more geared towards Alyssa Palladino and her nutrition guidance. But we are all for eating, so. All right. Oh, we have one more. Is there an alternative body weight exercise to lunges? Lunges hurt the knees, but squats for me are okay.
So the question is to work your lower body.
Just if there's an alternative body weight exercise to lunges. But he said squats are okay.
Well, have you done wall sits? Single leg. Okay. Okay. Yeah, I mean, wall sits, if you can do hip drives, like single leg hip drives, that's a great one. That shouldn't hurt your knee. Those are two that I would suggest.
Mm-hmm. All right. Seems like that is it. Susie says she has a stationary pedal for under her desk at home after she had meniscus surgery. That's awesome.
Awesome. Yes.
All right. So, I mean, if anyone doesn't have any other questions, we don't want to take up your whole day. I mean, if you do have any other questions about anything that we talked about, we will send you the PowerPoint. It'll be up on our Cox Fitness channel, and you can always email us and ask us any questions that you have as well. But I hope this webinar was informational for you guys and you learned a little bit more. But yeah, thank you for joining us.
Bye.
I will
Bye.
go ahead and stop the recording.
Bye. Thank you.
You're welcome. Bye-bye.